But for now, let's talk health, because officials in the Upper East region say they're struggling to deal with the growing cases of kidney disease. At least 21 out of 30 cases recorded within 9 months, a 9-month period, did not actually survive. That's a staggering 70% death rate. And this afternoon, we're taking you live to the region for analysis on the situation. We'll look at the causes and the difficulties authorities are facing in its management of the case. First, though, a report by Upper East correspondent Albert Sorry.
Adima Akelenga is an end-stage renal disease or kidney failure patient. It means his kidneys are no longer functioning. The kidneys are the organs of the body that filter waste and excess fluids from the blood, which are then passed out of the body in urine. When the kidneys lose their filtering abilities, as in the case of Akelenga here, dangerous levels of fluid, electrolytes, and waste can build up in the body.
My chest, this one, they have to make it for me, and then I will feel go out. I can't go work again. I can't feel do anything again.
Akelenga would need a kidney transplant to be well again, but the transplant is very expensive to do. He will need at least $13,500 US, the equivalent of 166,000 Ghana cedis or 1.6 billion old Ghana cedis to stand a chance of getting a transplant. But Akelenga is a former driver and laborer who is now unemployed because of his condition.
First, I'm doing road work, construction. Labor, I'm driving. Because the sickness, they say I can't come. I want to build a house. Now I sell all the blocks, all my zinc. I sell it because this sickness.
Akelenga's last option is dialysis, a process to remove waste products and excess fluid from the blood. This involves diverting the blood to a machine to be cleaned. Dialysis is also quite expensive, but it is a far cheaper option than a kidney transplant. They are performed in hemodialysis centers located in well-equipped hospitals. But the Upper East region does not have one of these centers, not even in the regional hospital in Bolgatanga. Akelenga, therefore, has to constantly travel from Bongo, where he lives, to Tamale in the northern region to have his dialysis performed. It is an expensive routine.
Plus the Lord fell, all I will spend 5.5. Always the one I go make the dialysis. I will buy things. I will buy these things. I will buy this medicine. It will be 90 CD. And then the cost it be 40 CD something. Even this one I not get buy. Somebody buy for me. They say I have to come 1 week 3 times. Because the money no day. So I always go 2 times for 1 week.
There are many patients like Akelenga with an end-stage renal disease who have to bear similar costs traveling from various parts of the Upper East region to Tamale to get dialysis. Many are not able to afford it and die as a result. Between March and December 2022 alone, over 30 kidney disease cases were recorded at the Bolgatanga Hospital. According to Dr Emmanuel Akatibo, a physician specialist at the Bolgatanga Hospital, at least 21 of the patients died.
We had about 20 of them who had the end stage, but 15 could afford to go to Tamale for the dialysis. The other 5, they couldn't afford and they passed on in the hospital here. Then those who had acute kidney injury, there were about 8 4 were from maternity, like the women who delivered bled a lot and then their kidneys were shut down, they needed dialysis. So by the time we could organize to send them to Tamale, they passed on. Then the other 2 were from the medical ward itself, who had acute kidney injury from a very severe infection and then needed a dialysis. Unfortunately, when we spoke about referral to Tamale, gathering money for the ambulance alone was a problem. So by the time they were ready to go, by that time it was too late. So out of those who had acute kidney injury, we had about 6 deaths as at last year. For those who had the end-stage kidney disease, who were going to Tamale for the dialysis, 15 of them we lost along the way. That makes it about 21 patients out of. There were even more than 30, but the others, they were at a stage where they didn't need dialysis. So those ones, we monitor them on OPD basis to make sure they remain where they are.
He says the situation could have been managed or even averted if the Bolgatanga Hospital had a hemodialysis center.
When I came and I saw the staggering number of people with kidney disease, and I said, no, this is no longer about a disease of maybe the rich or only those who have money who can afford it. So long as they're able to go to Tamale to do dialysis, it means that we have a good number of people who can afford it. And having that huge number with kidney failure is a lot. And what about even those who develop what we call the acute kidney injury and needed just some dialysis support, like 3-4 sessions, for the kidneys to recover, and then they don't need to be on it for life. We just have to watch on and say, maybe because the numbers are not many, we allow those people to die. Is that serious?
In the absence of the hemodialysis center, nurses at the Bolgatanga Hospital have to help temporarily manage patients like Akelinga until they are able to gather enough money to travel to Tamale for dialysis. But even that is quite challenging for the nurses. Ayamga Ayariga is a critical care nurse at the Bolgatanga Hospital.
To treat the particular infection that has caused the person to get an acute kidney injury, you at the same time have to perform the functions of the kidney on their behalf, and that requires that you do so with a renal replacement therapy, specifically hemodialysis. That has to be done with hemodialysis machines. Unfortunately, in our setting at the moment, we don't have that.
Management of the Bolgatanga Hospital has therefore initiated a campaign to raise funds to set up a hemodialysis center at the hospital.
Brand new machines are quite expensive, but majority of dialysis centers in Ghana, mostly they are refurbished machines, and we are looking at price range between 60 to close to 100,000, depending on the year model you may be able to get. So at least we are even hoping that at least even if we get 4 machines to start with, the reason being that there are certain people that when they have certain type of infection, you can't let them use the same machine with somebody who doesn't have that. And we are looking at between 800 and something to close to 1 million Ghana cedi. If we get that, I'm sure most of the things we want to do, at least to start with, we'll be able to do with the 4 machines.
Adima Akelinga appeals on behalf of all patients with kidney failure in the Upper East region.
If the dialysis is probably here, that will be fine. We are plenty. You're suffering. This thing is water us. So I don't know what I will do myself. So I'm begging. So if government will help us, it should help us and make for us. And it should come to Bulgaria here. If I get it.
Donations may be sent to the account details listed in this flyer put out by the management of the Bolgatanga Hospital. The phone numbers here may also be contacted for further inquiries. Albert Sorry, Joy News, Bolgatanga.
Let's stay on this a bit. Let's take you live now to the region. For more on this, Dr. Emmanuel Akatibo, a physician specialist at the Bolgatanga Hospital, is also with us. Of course, is our regional correspondent, Albert. Sorry, Albert, thank you for joining us. First of all, How did you get to know about the situation, and what update are you able to give on this?
Yes, so the management of the Bolgatanga Hospital decided to involve us journalists in the story because just as you heard in the story, they initiated a campaign to try and get the hemodialysis center for the Bolgatanga Hospital. So it was the management of the hospital that had contacted us to see if we can highlight the story, tell the story of the plight that patients like Akelma that you just heard are facing, having to travel to the northern region to get dialysis. So that's how we got to hear about the story.
So for now, what's the critical need of the hospital which could basically solve this problem?
Yes, so if you look at the Upper East region, it has grown in population over the years. And from what the doctor told us when we interviewed him for the story, one of the things he said was that usually because there is pressure on government to try and refurbish all hospitals across the country, there are needs like this hemodialysis center that they are not able to do. So normally the government tends to put centers like that in areas where they feel there are higher numbers of people with kidney injury problems. And in the past, the Upper East region was not seen to be one of those regions where cases of kidney failure and kidney injuries are normally, at a very high number. So it's the reason the hospital hasn't had up to this point. But since he joined the hospital, he realized that the number of cases that are coming, more than 30 only last year, between March and December when he joined the hospital. The hospital feels that this is a number that is staggering, and so something needs to be done about it. And so the main need now is for the hemodialysis center to be set up so that the patients who come with problems of the kidney can get dialysis. Remember, he also said that there are patients who came when they got the diagnosis and they needed to travel to Tamale for the dialysis. When the cost was given to them, they felt that it wasn't something they could afford. And so a lot of them decided not to go for the dialysis. And so the result of that is that after a few weeks, when you don't go and get dialysis, you definitely lose your life. And so that is the challenge. The main need now is the hemodialysis center to help people, especially those who have the chance to recover after 1 or 2, or maybe just a few sessions of the dialysis.
Ever since the airing of the story, are we beginning to make contact with authorities in the Upper East region as well?
Yes, so this is the first time we are airing the story, and the hope is that when people see this story, they will be motivated to come on board and support. There are a lot of other media houses that have been involved in the story because the regional hospital is doing a campaign to motivate people to see if donations can come in so that this hemodialysis center can be set up. So the expectation is that when this story goes out and with the discussions that are coming on the back of it, we will get some results.
Albert, thank you for joining us. Let's speak to Dr. Emmanuel as well. He's with the hospital, so he's able to tell us what exactly their problems are. But Doc, thank you for your time. I was just asking about how much will be needed and crucially needed to complete and check all of these systems so you're able to treat patients there. But beyond that as well, have you made any attempts to get government to solve the problem? Dr. Emmanuel, if you can hear me, I'm just asking if you made any attempts in the past.
Yes, good afternoon to your viewers and your listeners as well. Can you hear me?
Loud and clear, sir.
Yes, I'm on a room, so that's why probably the network is bad. Yes, thank you for your viewers and listeners. Yes, we've made some effort to that effect. We've written a proposal to which we've now held the Directorate, the regional minister, and some other relevant people in the region. We know this is a project that maybe government may not be able to fund it alone, especially the challenges that comes with public health institutions. But we think that with individuals and corporate Ghana, they can support this and will be able to set it up. So that is what we've done so far. The proposal has gone out, not to everybody, but at least the key people, deliver the proposals to them.
Do we know what the medical condition or underlying problems are, a reason for which we're seeing this sharp rise in the cases?
Yes, so traditionally, we are looking at people who have hypertension and diabetes. That is a traditional risk factors for people who end up developing kidney disease, chronic kidney disease. For the acute kidney disease, most of the times it's either infections or medications. But in our case, we realized that most of them were young people, and you didn't find the traditional risk factors in them like hypertension or diabetes. And when you go down the history, you realize that probably they were abusing herbal medications, even some of the orthodox medications that can even cause kidney disease. Some of them were abusing them for various reasons. But we don't have the empirical research evidence to show that, but we know that this is happening, especially in the young patients who do not have the traditional risk factor that will predispose them to developing a chronic kidney disease.
But in this case, this is happening in a region where, of course, the standard of living appears to be poor, and even some of the patients are already complaining about how expensive the treatment process is. Do you have any means of reaching out to these people, trying to help them out?
Yeah, so as yesterday, one of them even called me. I think it is one of the patients Albert had the interview with him. He called me yesterday. The last time he went to Tamale to do the dialysis was about a week ago. And yesterday he went into pulmonary edema. When they don't dialyze him, the fluid will collect. He was in the hospital. He called me on phone. And it was quite challenging as how to mobilize and help this patient. Yes, we know it's a very expensive process, but we think that some of them are able to afford it. Then we should make it available. And the additional thing is that some of those who develop the acute kidney injury, whereby you think that when you dialyze them 3 or 4 sessions, they can recover and live their normal life. I mean, these people, you just look on and watch and then they die, because these are people who may not be on long-term dialysis.
So if the authorities are listening now and, benevolent individuals, what would you want them to know, and how dire is the situation, a reason for which they must come through?
I want them to know that dialysis is no longer a luxury for few people. It is something that is an intervention that can save a lot of lives. And we should make it a point that we should make it available to at least and accessible to all sorts of patients. Those who can afford can go through it. Those who cannot even afford and they develop acute kidney injury, sometimes the system can offer them that help. Then probably later on they will be able to mobilize money to come and pay. Otherwise, if you talk about referring them to the nearest point of care, which is Tamale, taking the ambulance alone will cost some of them more than 1,000 cedi. That could have been used for the first session of dialysis. And this is something that when you talk about transfer, they will just think that that is the end of the story, and they wouldn't go. But you know very well that if something is done about it in 2 or 3 sessions.
Apologies there. We've lost Dr. Emmanuel Akatibo, but point well made there. You can also be a part of that process just to support the regional hospital in the Upper East.